Sabrina. I'm going to be doing your physical assessment today. Everything we do will be confidential and private. You do have a right to refuse your physical assessment, but if it's okay with you, we'll go ahead and get started. Okay? So I'm just going to look at your face. Inspecting for lesions, rashes, facial hair. Everything looks normal. Just going to check for any knots or tenderness or masses. Everything feels okay. Any of that sore? No. Okay. Can you smile? Okay. And then just check some. Alright, we're going to check and see if your TMJ is tender or sore. Can you open and close your mouth for me? Alright, no clicks, no pain. And then we're going to check your cranial nerve 5. If you'll clench your teeth for me. Alright, keep me from opening your mouth. Alright. I'm going to get you to close your eyes. I'm going to rub something soft on your face. And I want you to tell me when you feel it, okay? Is it soft or sharp or hard? Soft. Okay. Open your eyes for me. Let's assess the cranial nerve 7. I need you to smile for me. Frown. Close your eyes tightly. Lift your eyebrows. Let me see those teeth. Puff those cheeks. Anything hurt? Any pain? Alright, now I want to see how good you can see, so if you'll stand up for me. And right there on the wall is a chart. I want you to cover your left eye and read the lowest line for me. ORZSK. And cover your right eye and do the same. ORZSK. Alright, have a seat. So, both eyes, left and right, is 20/20 vision. So now let's check for the cranial nerve 3, 4, and 6. And what I'm going to do is I'm going to move my finger in different directions. And I want you to follow my finger only with your eyes and not your head, okay? Okay. Good job. All right, now let's check for cranial nerve with a pin light 3, 4, and 6. We're going to check and see if your eyes constrict and dilate. Okay, good job. Pupil size were equal, round, and 4 millimeters, and responded to light. And now we're going to assess for cranial nerve 3. And I want you to look at this pin light, and then I'm going to get you to stare at an object behind me, okay? Okay, look behind me. Great. Okay, I'm just going to be looking at your eyebrows and your eyelashes. No lesions, they're symmetrical, evenly distributed. No growths, no nodules. Conjunctiva is pink, moist, no lesions. Sclera is white. Corneas are clear and round and symmetrical. No drainage. Okay, now we're going to be taking a look at your ear, nose, and throat and mouth. So I'm just going to be kind of looking at your ears. And you ever have any ear pain or ear hurt? No. Does it hurt when I touch? No. Okay, I'm going to do what's called a whisper test. And what I'm going to do is hold this sign, and I'm going to whisper a word. I need you to repeat it, and then I'm going to do the same thing on this side, okay? Ready? Mom. Rocks. And then I'm going to move on to your nose and see there's no drainage. Do you have any sinus problems or anything right now? Alright, I just want you to close one side. Snip. Snip. Good. Hey. See, now I'm going to check your sinuses. Does that hurt? No. Does that hurt? Alright. And then I'm going to need you to open your mouth for me. Alright. Tonsils are +1. is shiny and moist. The uvula is midline. And now we're going to take a look at your cranial nerve 9 and 10. So right now I just need you to say ah. And let me see. Do it one more time. Thank you. And now I want you to tell me, or actually you'll feel it. I'm going to take your gag reflex, okay? Okay. Sorry about that. Now I'm going to check cranial nerve 12. And so what I need you to do is stick your tongue out for me. And then I'm going to take this tongue blade, and whatever side I put it on, I need you to go put your tongue to the opposite. There you go. There you go. Okay, now we're going to take a look at your neck. Are you having any neck swelling, any neck pain? Have you noticed any swollen nodes? Alright, let's check some preauricular lymph nodes, postauricular, occipital. Is any of this hurting? No. Under your chin. Submandibular. Tonsils. You still have your tonsils, right? Mm-hmm. Superficial cervical. Is any of this hurting? No. Any discomfort? No. Posterior cervical. I'm going to have to push just a little harder, okay? Is that hurt? No. Is that hurt? No. Alright, no lymph nodes. The ones that I did feel were soft and no pain reported. Now let's assess cranial nerve 11. So I'm going to instruct you to do a series of tests. If you'll touch your chin to your chest. Sit up straight for me, please. Turn your head side to side. Touch your ear to each shoulder. And extend your head backwards. Did any of that hurt? No. Alright, let's check some resistance. I want you to take your head and turn towards my hand. Good job. Good job. Shrug your shoulders for me. Alright, and checking your trachea and your thyroid. Does that hurt? Can you swallow for me? Thank you. I'm going to checking your carotid pulse. That's regular. Normal bilaterally. Alright, now I'm going to be assessing for something called a Brui. So I'm going to put my stethoscope in my ears and I'll be listening for a swishing noise. You hold your breath for me. Hold your breath. No Brui noted. Alright, now we're just going to be looking at your back. You ever had any back problems, any injuries or anything to your back? No. Any pain anywhere? No. Great. No rashes, no lesions. Now what I'm going to do is I'm going to be assessing for tactile friendliness and symmetrical expansion. So I'm going to take the balls of my hand and I want you to say the number 99 every time you feel my hands, okay? 99, 99, 99, 99. Very good. Equal tactile friendliness bilaterally. Now you're going to feel me put 2 fingers on each side of your back, and I'm going to have this little hammer that I'm going to, it's called a flex hammer, and I'm going to kind of assess your back for your lung fields and see if I hear any abnormalities, okay? It's not going to hurt. Any pain, any tenderness, anything hurting? Very good. I did hear resonance bilaterally, and now I'm going to check for tenderness in this area right here. Does this hurt? Okay, you're gonna find me apply a little bit of pressure, okay? And I need you to let me know if there's any pain. No. Now you'll just be real quiet for me. I'm gonna be listening to your breath sounds. Breathe in. Out. In. In. Begin. Again. Two more times. Again. Good job. Alright, now we're going to take a look at your arms. Have you ever had any broken bones or anything like that? Any surgeries? Any abnormal rashes going on? No, they appear symmetrical, no lesions, no rashes. Alright. Now I'm going to check some pulses. This is your brachial pulse. Good, those are present. Radial. Good. And ulnar. Good, pulses are present and equal bilaterally. Now I'm going to be checking your capillary refills. If you'll just hold your fingers out for me, I'm going to be pushing on your nails. Blanching noted, refills less than 2 seconds. Now we're going to do some exercises called range of motion. I want you to repeat after me. I want you to take your arms and flex them above your head. Hyperstand them back in Superman. And then I want you to take your elbows in and out. And then I want you to forearm, pronate and supinate. Alright, now I want you to bring your elbows to you. Push against me, out, try to bring them up. Did any of that hurt? Good. Make a fist for me, like you're riding a motorcycle. Up, down. Spread open your fingers. Good. Now I want you to touch your thumb to each finger. 1, 2, 3, 4, 5. Now I'm going to be testing for graphesthesia. I'm going to get you to close your eyes and hold out your hand, and I'm going to be drawing a number on each hand, and I want you to tell me what I'm drawing, okay? It will be a number. 3, 7. Good job. Now I'm going to be testing for something called sterorachnosis, and I need you to close your eyes. And I'm going to be placing an object in your hand, and I want you to tell me what that object is. Okay, first object, close your hand. Good job. Paper clip. Alright, now let's check those reflexes. Alright, we're going to be checking the tricep, bicep, and brachial reflexes. And if you will kind of drape your arm over me. Good job. Right now we're going to check your reflexes in your opposite arm. We got the tricep, and the bicep, and the brachial. Alright, now we're going to be taking a look at your chest. Any trauma or injury to these areas? Any pain? No. Alright. And no rashes, no moles, no lesions or anything present. No, I'm just kind of looking and looking for your PMI, basically where your heart's beating, see if I see any pulsating or heaves or thrills, and I'm just kind of looking at it. Any pain or
No.
you ever feel like your heart's racing or anything like that?
No.
You could be listening to some of your heart sounds. Let's see, aorta. Pulmonary. Tricuspid and mitral valve. No extra sounds noted. I hear S1 and S2. It's too far. Now I'm just listening for some heart murmurs. Aortic. Pulmonic. Tricuspid. And the mitral. Alright, we're moving right along, we're almost done, so now I'm going to be looking at any lesions or masses or any skin problems in your abdomen. You ever had any tummy problems?
No.
Any pain?
No.
There's no visible peristalsis or any visible pulsations. Does any of that hurt?
No.
And there's no rashes, no lesions. There's no hernia present, no contour. Now, I'm going to be looking at listening also to your vowel sounds. My stethoscope. Vowel sounds present actually in all four quadrants. Now I'm listening to your aorta, your abdominal aorta. No bruit. Now I'm going to listen to your renal arteries. No bruit noted. And I'm going to press all four quadrants. Any tenderness, any pain?
No.
I'm just going to kind of push on the tummy some, okay? Does this hurt?
No.
All right, a little bit harder, okay? Does this hurt?
No.
Is that okay?
Mm-hmm.
All right. I'm making sure that your liver is not. Does that hurt?
No.
Good deal. All right, now we're going to move on to your legs and your feet, and we're almost done. So, I'm looking for reports of any rashes and lesions. You've had any injuries or trauma to the leg area, your feet, you've broken any bones.
No.
All right, no edema noted. No discolorations, no bruises, no scars. Let me check them for some pulses, okay? Can you check that popliteal pulse? Okay, they're good and strong. We're moving on down here to the posterior. Great, good and strong on the dorsalis. Great, now let's do some exercises. If you will take your hips and raise your legs up to 90 degrees. Great, lower. Now if you will bend your knees to your chest. Great, now if you'll rotate your, pointing your knees in and out. Very good. Any of this hurting, any of it uncomfortable? Now feel Superman your legs, basically. Out and in, one at a time. Great. Now if you will take your feet, point them up, point them down, out, in. Sit up for me. Great. Now we're going to do the same thing. When you lift your feet up, you can smile. Does that hurt? Let's do the same thing now. Does that hurt? Okay. Let's check some reflexes. Alright, now we're going to check the patella. The Achilles. Great, now I'm going to see you. Is this ticklish? Again? Let's step back in, see his reflex. Now if you will take your foot, the heel of your foot, and we're going to run it down each shin and check your cerebellar function. Good, now if you stand up for me, turn this way. I need you to walk on your heels to the wall. And walk back on your toes. Now if you're facing me, I need you to stand straight up and close your eyes. Great, no swaying noted. If you'll hop on your right leg for me, and hop on your left foot. Great. If you will turn over, or not turn over, excuse me, turn around, face the wall. And back up just a little bit. If you'll bend over, I'm going to inspect and knock at your spine. Any back pain, any back trouble? No abnormalities, curvature is normal. Now, if you'll turn around and face me, we're going to do some exercises. If you'll bend over, touch your toes. Great. Now, if you'll bend sideways, the other side, bend backwards, and now twist.